You have now learned the concepts of health insurance providers. Let's review some of the key areas from this section that will help you prepare to pass. Service providers. Service providers receive premium payments from a subscriber in return for providing benefits, including services provided by hospitals and physicians. People who use a service provider are usually not billed for their care because they've already paid for the care with their premium payments. Blue Cross Blue Shield. Blue Cross Blue Shield organizations have a contractual agreement with physicians and hospitals. Blue plans are voluntary, not-for-profit healthcare organizations. They're not an insurance company. They're considered a prepaid plan because each subscriber pays a set fee in order to receive services. They're also considered a service plan because benefits are paid to physicians and hospitals instead of the insured. Blue Cross Blue Shield uses experience rating for large groups and community rating for small groups and individuals. HMO. Most HMOs operate exclusively through a group enrollment system. Each member of the group pays a premium, whether or not the person uses the services of the HMO. By having services prepaid, the individuals are encouraged to see a doctor early so that preventative measures may be taken. By encouraging preventative medicine, it is expected that the general health of all HMO subscribers will benefit from early detection and treatment. This means that many of the more costly procedures that become necessary when a condition has further progressed can be avoided. Laws and regulations. In most states, the requirement to starting an HMO include the following: obtain a certificate of authority, obtain a valid healthcare provider certificate, meet capital and surplus minimum requirements, make a deposit of $10,000 to the Rehabilitation and Administrative Expense Fund, and become a member of the state's Health Maintenance Organization Consumer Assistance Plan. PPO. A PPO is a group of physicians and hospitals that contract with the employers, the insurers, or third-party organizations to provide medical care services at a reduced fee. PPOs differ from HMOs in two ways. First, they do not provide care on a prepaid basis. Physicians are paid a fee for service. Secondly, subscribers are not required to use physicians or facilities that have contracts with the PPO. Medicare. Medicare is a federal medical expense insurance program for people age 65 or older. Medicare benefits are also available to anyone regardless of age who has been entitled to disability income benefits for 2 years or has chronic kidney disease or end-stage renal disease. Medicare is administered by the Center for Medicare and Medicaid Services, which is a division of the United States Department of Health and Human Services. Medicare is divided into 4 parts. Medicare Part A, which helps pay for inpatient hospital care, inpatient care in a skilled nursing facility, home health care, and hospice care. Medicare Part B pays for doctor services and a variety of other medical services and supplies that are not covered by hospital insurance. Most services are needed by people with permanent kidney failure. Medical insurance Part B is optional and offered to everyone who enrolls in Part A. If Part B is initially declined, you must wait until the next general enrollment. Medicare Part C is known as Medicare Choice or Medicare Advantage. To be eligible for Medicare Advantage, enrollees must also be enrolled in Medicare Part A and B. Medicare Advantage is Medicare provided by an approved health maintenance organization or preferred provider organization. Medicare Part D. This optional coverage provides access to private prescription drug plans that contract with Medicare. Medicaid is a federal and state-funded program for those whose income and resources are insufficient to meet the cost of necessary medical care. The federal government provides about 56 cents for every Medicaid dollar spent, and the state government provides the balance. Fully understanding the key topics just discussed are essential as you prepare to pass.